What's up, YouTube? It's your boy Josh Reese back at it again with another video. Go ahead, before we start, smash that like button and also subscribe. And today we're going to be talking about different specialties in the optometry profession. And if you might think optometry is not for me because I don't want to be just giving people glasses all day. Well, there's plenty more you can do with an optometry degree, and I'm here to help explore with you. So first things first, wanted to try to talk about what optometry is in the first place. So what an optometrist is it's an eye doctor. So anything you need with the eyes, the optometrist can do beyond surgeries. So the only thing the optometrist can't do is surgeries. Now it's a legislative profession, meaning that states pass laws to say what an optometrist can and can't do. So there are some states that have permitted optometrists to do laser surgeries. Other states don't have them able to do any surgeries. So that'll grow in the future. So if you wanted to do some laser surgeries on eyes in the future, that doesn't mean that if you want to become an optometrist, that's out of the question. It just means not yet. So the first kind of thing that I'll talk about as far as the broadness of the optometry profession is general optometry. So, you go to America's Best, LensCrafters, Costco, Walmart, Target to get an eye exam done. That is an optometrist, right? So general optometry, even, if you open up your own private practice, you can do this as well. It's just prescribed. So they check your eyes, get your overall health, check your prescription again, and then change your prescription, recommend new glasses, new contacts, depending on how your prescription's changed. And so that's kind of the first thing that general optometrists do is kind of, just give you new glasses, contacts. Now, within the scope of general optometry as well, there is there's also, people come in with dry eye. You can treat that, give them medicine, how to take care of that. People come in with something stuck in their eye, a foreign body in their eye. You can help that. You can treat that. That's all within general optometry as well. So the second thing that we can do as optometrists is specialty contact lenses. So you'll have people with wonky eyes that need very unique contacts. There's hard contacts, there's gas permeable contacts, there's CRT lenses. There's a lot of stuff that you can do with contacts. So if you're one of those people who really loves contacts, there's actually a whole subset of optometry where you can go and explore and help people with their specialty contact lenses that they need. Next part of optometry is actually hospitals, so like post-op and pre-op. So you work hand in hand with an ophthalmologist. The ophthalmologist will be doing the surgery, but you'll be seeing the patient before and after the surgery to make sure their eyes are good. Tell them what they should, do as far as treatment wise. But yeah, optometry work hand in hand with doctors such as ophthalmologists and doing eye surgeries and things like that. So you're really in the overall eye health. Now, a big subset of that is VA hospitals. Veterans hospitals is a big employer for optometrists because all these old people have really, really bad eyes, and you can treat their glaucoma, macular degeneration. You need to diabetes can do stuff with the eye. You need to be able to have good optometrists in VA hospitals and work with the geriatric population. One thing that I love, and this is actually the thing that I'm doing, is called vision development in optometry. So it's within the scope of practice as an optometrist to help vision develop in people, know how they can better use their eyes and help them better use their eyes. So a lot of people will refer to it as vision therapy. So this is most common with children and also with brain injury patients who have developed an eye deficiency. So there's kind of 3 subsets in that. People could have a hard time pointing their eyes, pointing at something up close, pointing at something far away, have something like a convergence insufficiency. And that can be 100% treatable with vision therapy. You can help people have exercises that they can do in office and at home to help them better point their eyes. Some people have a hard time tracking or reading, going side to side with their eyes, and have a saccadic disorder. And you can treat that with therapy. And people could have a focusing problem, or a problem with their accommodative system. And that's also treatable with vision therapy. So vision development is a really big thing. If you want to work with, let's say, a stroke patient who can't use their eyes very well, you could definitely help them see 100% better. So many people, especially, brain injuries or children who have trouble with school, don't know, don't have solutions to their problems. And some people might just think they're dumb. But really, you can help that with vision therapy, and these kids could read perfectly fine after that, or these brain injury patients could, have their symptoms just kind of go away if vision therapy was what they needed. The next subset of the optometry profession that I want to talk about is academia. So if you want to teach at optometry school, they need optometrists to teach there. It's a really growing profession. They're looking to open new schools. There's only 23 of them in the country. You could work teaching in an optometry school. Now, most of the people who actually teach in optometry school practice optometry on the side. So if you want to practice and teach at a school, that is very viable, and a lot of people do that. So, if you wanted to be a teacher, but you wanted to be an optometrist a little bit more, you don't have to compromise. You could be a teacher and an optometrist. Just teach at an optometry school. So the world's open for you there. Now, the next and last subset I'm going to talk about as far as optometry goes is probably that sorry, my dog. It's a handful sometimes. For optometrists, you can man, I lost my train of thought. Well, see you guys later. Bye.